Makeup artist Natalie Hanks likes to make people look and feel good. But for years, she struggled with her own appearance. Aged 11, her legs started to swell in size and became painful to touch.
I do remember going to the doctors when I was around 13 and they told my mum to just put me on a diet. Growing up then through my teen years, I always had a small waist, but my legs were just getting bigger.
It would take another 20 years before she was diagnosed with lipedema, an excruciating medical condition that causes an abnormal build-up of fat cells. And what was the effect on your mental health?
So I was pushing myself to the limit and I just started throwing up everything I ate, which now I can see not the best thing to do, but at the time I thought that was the best thing for me. And it wasn't. I still didn't lose the weight off my legs.
After countless doctor's appointments with no diagnosis, it was a client who suggested she might have lipedema.
She came over to me and she said, I hope you don't mind me saying this, but you've got quite big legs. And I just said, oh yeah, I know, I've had them for years. And she said, no, I want you to look into lipedema. So I said, oh, what's that? And she told me about it, and to be honest, I didn't believe her. I was like, oh, no, I haven't got that, I'll lose this weight myself. But the words were stuck in my head then, so that's when I went to Google it, and loads of things came up, and I was like, wow, this is me, this is everything. I had all the symptoms. I had the pain, the shape of the legs, everything that comes with lipedema. I had the symptoms.
Lipedema is thought to be hereditary and linked to hormones. Symptoms tend to start at puberty, during pregnancy or menopause. It's often misdiagnosed and mistaken for obesity. Lipedema doesn't respond to conventional methods of weight loss like diet and exercise. This woman with the condition developed anorexia but still had fat deposits on her hips and legs. The only treatment is liposuction, but it's almost impossible to get on the NHS because it's classed as cosmetic surgery. Natalie, who's a mum of 3, decided her only option was to pay for surgery. She's had 4 operations in 3 years and spent £40,000.
I knew that if I didn't do this, I wouldn't be walking soon. My legs would be becoming that painful, that heavy, that swollen. I probably wouldn't even be working either. It had to be done.
Nikki Maisie is a GP specialising in weight management. She also has lipedema, something she discovered after a chance conversation with the charity Lipoedema UK.
It was fascinating and it was shocking, and I looked at the pictures and I thought, actually that's all the women in my family, and I've probably got a low grade, low type 1, type 2.
Nikki says there needs to be more awareness and more help available on the NHS.
I think the problem is they're expected to lose that weight. This is a fatty tissue that will not go with weight loss.
The major issue is lack of training and awareness amongst the entire medical profession, which means that women are brushed off and basically disbelieved because the medical profession are not looking for a medical condition. They just see somebody who seems to have a problem with diet and appearance, when basically they should be looking at this as something quite serious that is chronic and will progress over the years to something that could cause serious disabilities.
Since starting her blog, Lippy Legs, Natalie's been contacted by hundreds of women, all looking for help and advice. After years of pain and shame, she wants others to know life can get better. Anna Yosef, ITV News.